Welcome to the Elevate Textiles New Employee Benefits Orientation. We are very excited that you've decided to join our team. This presentation is a review of the benefits available to our employees. Today we will cover the benefits we offer and who is eligible to participate. Let's get started with a few important informational items. As a new hire, your benefits will be effective after you have been employed full-time for 60 consecutive days. You will need to complete your elections and UKG Pro within the first 30 days of your employment. Eligible dependents include legally married spouses and children. This can be your own children and stepchildren. In some cases, other children in your custody may also be covered. See your HR representative for more information. After you have made your elections and they go into effect, they must remain in place until the end of the year unless you experience a qualifying life event. Life events include birth of adoption of a child, marriage or divorce, or if you or someone in your family gains or loses access to other coverage. If you experience a life event, you must notify your local HR representative within 30 days of the date the event occurred in order to make a change. If you miss the 30-day deadline, your change will not be allowed. Each year, Elevate holds an annual open enrollment period to allow you a window of opportunity to make changes to your coverage for the upcoming New Year calendar. Until then, unless you have one of the listed qualifying events, your benefit elections will remain in place. Now let's talk about Elevate's group medical and pharmacy plan. Elevate offers a choice of medical plan options so you can choose the plan that best meets your needs and those of your family. You can choose between the high deductible plan, the basic PPO plan, and the plus PPO plan. Medical benefits are offered through Blue Cross Blue Shield of North Carolina, and pharmacy benefits are offered through Express Scripts. Blue Cross Blue Shield and Express Scripts both have nationwide network of providers that you can choose from. Therefore, regardless of where you are traveling, you can find an in-network provider. The chart on this slide shows the deductibles, coinsurance, and out-of-pocket maximums depending on the plan option you choose. If you choose the high deductible plan, you and your family are responsible for the full cost of coverage until you meet the individual or family deductible. Preventative care is an exception and is covered at 100%. The plan has an aggregate deductible and aggregate out-of-pocket limit. This means that the deductible and out-of-pocket limits are determined by your type of coverage. The individual deductible and out-of-pocket limits apply if you select employee-only coverage. Otherwise, the family deductible and out-of-pocket limits apply. Each covered family member contributes to the same deductible and out-of-pocket limit. However, no member in your family will have to pay more than the family deductible and out-of-pocket limit listed above. Once the deductible is met, you are responsible for your portion of coinsurance. There is a health savings account attached to this plan that you can contribute to on a pre-tax basis and use to help offset costs until the deductible is met. Elevate also contributes to your HSA on your behalf. If you elect one of the PPO plans, you will have copays for most office visits, and you must meet your deductible first for most inpatient and outpatient visits before coinsurance kicks in. Here's a snapshot of your prescription drug benefits associated with each plan. Your prescription benefits are administered through Express Scripts. You will receive a separate ID card from Express Scripts to use at the pharmacy. Please note, mail order is required for maintenance medications. You will receive 3 courtesy fills at the retail pharmacy before you begin to pay 100% of the cost if you don't move your maintenance medications to mail order. Elevate partners with SiriusMD to provide telehealth services to employees, spouses, and dependents enrolled in an Elevate medical plan. The benefit offers no cost 24/7 access to medical providers. Contact SiriusMD for any health concern, even if you have a question. Once you download the SiriusMD app and complete the simple registration process, connecting with a doctor is as easy as texting a friend or family member. And don't just take my word for it. Here are some of the things your coworkers are saying about their experiences with SiriusMD. Our experience with SiriusMD saved my family both time and money. The app was easy to navigate, and the healthcare providers addressed our questions in minutes. Plus, because we were able to access the healthcare late at night, we were able to avoid an emergency room visit. Called my family doctor, no appointments available until Wednesday, so was planning on going to urgent care after work. I love this program though, perfect for a working person. SiriusMD is one of the best benefits our company has added in years. It's easy to use. The providers are super nice, helpful, and courteous. Highly recommended anyone use this service in advance of going to a primary care doctor. It doesn't hurt to start with this service. It could save you a lot of time, money, and aggravation. Let's discuss in more detail the health savings account that pairs with the high deductible medical plan option. An HSA is a tax-favored savings account created for the purpose of paying for eligible healthcare expenses. This account is set up for you by Health Equity and is yours to keep and take with you if you ever leave the company. A health savings account allows tax-free withdrawals to pay for qualified medical expenses and allows you to contribute on a pre-tax basis, usually through payroll deductions. Elevate will provide seed money into your HSA. You may also make contributions to your account through pre-tax payroll deductions. The total combined contributions cannot exceed the annual limit set by the IRS. For 2024, the maximum contribution is $4,150 for an individual and $8,300 for a family. However, if you are 55 or older, you have the option of contributing up to an additional $1,000 each year. Now let's review the basics of a health savings account. Your health savings account, HSA, is a tax-advantaged medical savings account that can help you pay for qualified healthcare expenses now. In the future and during enrollment, you and your employer can contribute to your HSA to save money for future expenses, and your funds may carry over from year to year. The money in your HSA is yours, even if you change jobs, and once you reach a $2,000 account balance, funds may be invested and earn interest for greater savings potential. With an FSA, you can save on taxes. You won't pay taxes on the money you and your employer contribute to your account, on interest earned on your account, when you withdraw funds for eligible health related expenses. Who can contribute to the health savings account? If you are enrolled in a qualified high deductible health plan and are not claimed as a dependent on another person's tax return, you can contribute to an HSA. You cannot be enrolled in Medicare or TRICARE, and you cannot be covered on another non qualified health plan. Also, you cannot have access to a full purpose flexible spending account, even if it is through your spouse, adult children, and or domestic partners may not be eligible dependent. Consult your tax advisor for more information. Hospital indemnity insurance pays cash benefits for inpatient hospital expenses that result from covered accidents or sicknesses. You can use the payments from this benefit however you want to offset out of pocket medical bills or to help pay your rent, mortgage, or other bills. If you enroll in the high deductible health plan, you will automatically be enrolled in this benefit at no cost to you. Dental plans. Regular dental exams can help you and your dentist detect problems in the early stages when treatment is more basic and costs are much lower. Keeping your teeth and gums clean and healthy will help prevent most tooth decay and periodontal disease. It is also an important part of maintaining your medical health. Elevate offers a basic and plus dental plan option for you to choose between. Here's a snapshot of the coverage offered by each plan. Please note, there is no coverage for in progress orthodontia, meaning that there is no coverage for treatment that began before coverage in the Plus plan started. Vision plans, IMED Network. Elevate's vision coverage is through Amaritas and uses IMED's network. This is a snapshot of how the vision plan works. You can choose between the basic and the deluxe plan. Both vision plans provide coverage for glasses and contacts. The deluxe plan also provides coverage for eye exams. If you are enrolled in one of the Blue Cross Blue Shield of North Carolina medical plans, you are eligible for an annual eye exam covered at 100% through that benefit. Elevate offers two flexible spending accounts through Florida, a medical reimbursement account and a dependent care reimbursement account. Both spending accounts are designed to save you money on taxes. Both accounts work like a savings account. Each pay period, a pre-tax payroll deduction is deposited into your healthcare and/or dependent care account. The healthcare flexible spending account is typically used for medical, dental, and vision care expenses not covered by insurance, including copays, deductibles, eyeglasses, and certain over-the-counter medications. Please note, you cannot participate in the medical FSA program when you are enrolled in the HSA plan. A dependent care spending account allows you to pay for daycare expenses for a child who is enrolled in a daycare facility or a parent who needs daycare services. Children aged 12 and under are eligible and any dependent of any age if he or she lives with you and cannot care for himself or herself, such as an elderly parent or disabled child. Be sure to save every receipt when you are using your Flex card. FSA eligible expenses are defined by the IRS, and we've listed some of the common uses on this slide. You can use your account to cover expenses incurred by you, your spouse, or your children. Our medical FSA includes a rollover. You can roll over up to $640 of unused amounts to the next plan year. Any amounts remaining over $640 will be forfeited. The 2024 maximum annual contribution to your healthcare FSA is $3,200. You have access to the amount you elect January 1st or your coverage effective date. Please note, you cannot participate in the FSA program when you are enrolled in the HSA plan. Please refer to your benefits guide for more information. A dependent care flexible spending account allows you to set aside pre-tax monies to pay for child care expenses so you or your spouse can work or go to school. Children aged 12 and under are eligible and any dependent of any age if they live with you and cannot care for themselves, such as an elderly parent or disabled child. You may contribute up to $5,000 per year to your dependent care account. Unlike the medical FSA account, you only have access to the funds as they are contributed. Our dependent care FSA includes a grace period for unused funds at the end of the year. You have until March 31st of the following year to submit for claims reimbursement that occurred during the plan year. Remember, if you don't use it, you lose it. To access your Flora spending accounts, you will need a participant ID. This will be on the communications you receive through Flores and Associates. You can access your account anytime through www.flores247.com. Download Flores Mobile to access your account through your mobile device. Life and disability benefits are provided through Sun Life. Elevate provides basic employee life insurance in the amount of 1 times your base annual earnings and basic dependent life insurance in the amount of $2,000 for your spouse and dependents up to the age of 26. You can also elect to purchase supplemental life for you and your dependents. Please note, coverage amounts are reduced to 65% when you turn 70 and 50% when you turn 75. For information on rates and more detailed information on each plan, review your benefit guide. Short term and long term disability are also provided at no cost to you. If you are sick and out of work under a doctor's care due to a non work related accident or sickness, you are eligible to receive 25% of your base weekly earnings for up to a maximum of 26 weeks as approved by Sun Life. You can also elect to purchase supplemental short term disability insurance, giving you a total benefit of 60% of your base pay. If you remain out of work beyond 26 weeks, long term disability benefits pick up where short term disability benefits end. You will receive 60% of your base monthly earnings for up to 5 years as approved by Sun Life. This coverage is provided to you at no cost by the company. Health Advocate is a provider for our Employee Assistance Program in our advocacy services. These benefits are provided to you at no additional cost. Health Advocate will serve as a guide and advocate for navigating the healthcare system and claims issues. All benefit eligible employees, dependents, and household members are eligible, including parents and parents in law. As an independent third party, Health Advocate can confidentially resolve complicated and sensitive issues you may not feel comfortable discussing with your employer or others. Your privacy is protected and your identity is kept confidential. Health Advocate advocacy services include answering general questions about your benefits, explaining healthcare conditions, diagnosis and treatments, research and treatment options, arranging second opinions and transferring medical records, assistance finding the right in network doctors and help scheduling appointments, reviewing medical bills for errors or duplicate charges, as well as resolving complicated claims and billing issues. Health Advocate EAP services include support for personal problems such as working through relationship issues, stress, depression, and substance abuse. It also provides you with tools and resources to manage life's challenges. There are also work/life resources available. Health Advocate can assist in locating childcare, elder care, summer camps, and special needs services. Through Health Advocate, you also have access to legal and financial experts to help you save time and money. T. Rowe Price is a provider for our 401k retirement savings plan. Now let's discuss the details of our plan. All employees are able to participate in Elevate's 401k retirement savings plan upon hire. After your hire date, you'll have 30-day opt-out period to decide if you want to participate. If you don't opt out during that period, you will be automatically enrolled at a 5%. Pre-tax and Roth contributions are available, and all funds are immediately vested. You can start and stop contributions at any time. Elevate will match your contributions 100% of the first 3% and 50% on the next 2% of your eligible compensation. If you contribute 5%, the company will match 4%. If you have an existing 401k from a previous employer, you can roll that money into your account. Let's talk about vacation and holidays. You will become eligible for vacation benefits once you have been with Elevate for 6 months. If you reach your 6 month anniversary before October 1st, you will be eligible for 2 weeks of vacation in the current calendar year. If you reach your 6 month anniversary on October 1st or later, you will receive a 1 week of vacation in the current calendar year and 2 weeks the following calendar year. The accrual schedule is as follows. If you have been with the company for 6 months to less than 5 years, you will receive 2 weeks. If you have been with the company for 5 years but less than 10 years, you will receive 3 weeks. Employees with 10 or more years of service will receive 4 weeks of vacation. You may elect to be paid vacation cash, Vcash, without taking time off. You will receive your vacation pay in your paycheck and you can take the time off at a later date without getting paid. Pay accrues 10% per month from January to October. If you want to be paid for vacation time away from work, you must request time and pay, Vcash. Elevate provides 9 paid holidays per year to full-time team members. These include New Year's Day, Good Friday, Memorial Day, 4th of July, Labor Day, Thanksgiving Day, Christmas Day, and 2 floating holidays. You are eligible for paid holidays upon your date of hire. So what's next? You will need to look over your benefit enrollment guide and be ready to make your decisions this week. You have 30 days from your day of hire to complete your elections. You will need your legal name, date of birth, and social security number for any dependents you want to cover. The elections you make as a new hire will remain in effect through the current calendar year unless you experience a qualified life event. You will have a chance to make new elections each year during open enrollment. Once you enroll, you will receive an ID card from Blue Cross Blue Shield of North Carolina, Express Scripts, and Amaritas. Be on the lookout for an enrollment kit from T. Rowe Price at your home address for the 401k retirement plan. Remember, you will automatically be enrolled at 5% unless you choose to opt out and can change your contributions elections at any time. If you have any questions about any benefits discussed in this presentation, please feel free to contact your local HR representative. Thank you, and we are glad to have you as part of the Elevate Textiles team.